Chris, whenever you're ready, I've got you going.
Okay. Back at Senior Lobby here at the Capitol in Olympia on this wonderful Thursday. Chris Hansen along the way, enjoying some time at Senior Lobby, finding out more about this, and you are as well through our efforts here. I want to appreciate, again, say thanks to our camera guy back here behind it all, Ken Sterner, who you can't see waving, but he's waving at you all right now. He's not used to doing this, but he's done a great job doing tech for us today. A lot of great speakers here, one of who's been thoroughly involved so far today is Jerry Reilly. Jerry, involved with Medicaid, I know you said in the past here in Washington State, and currently our chair of a very important organization. Talk to us about that.
Well, I'm chair of the Senior Lobby, which is comprised of 12 organizations that either provide services to or advocate on behalf of elders in Washington and people with disabilities. Collectively, we serve about 300,000 people.
Okay, so quite a few folks out there that are dependent on your efforts, and you have been responsible for your chair position for how long with them?
About 4 years, I think, yes.
And involved in this kind of work, Jerry, for how long now?
Well, probably 40 years, because I've been involved in public service and government service. I have been medical assistance director in Washington State and was assistant secretary at DSHS. So I have been involved in these arenas for a long time.
Very good. So lots of experience that you bring to the table for these folks, needless to say. Jerry, it's a big question, I guess, but I'm interested to know through your experience, what has happened? Because we've talked so much here today about the economy and about how things have gotten so bleak, and yet it seems like the folks, at least in part, who are going to be dependent on the services that are being cut or in threats to being cut right now, were the ones that saw this ship all the way to right now. So how did all this go wrong? Because no one wanted to create this for their future. It's just become this way. What do you think really is the mechanism that broke down?
Well, you're asking me very big questions about the whole economy, and more particularly with regard to long-term care services and services for aged people. Washington has actually done a pretty good job since the 90s and the mid-90s in restructuring our system to move more toward services in the home rather than services in residential care settings. In 1995, we had about 18,000 people in our nursing facilities. Today we have about 10,000. Yet we're serving about 40,000 people in a variety of community settings. So we serve more people than we ever served in the past. We serve them in a way they prefer to be served, and yet we save money. So we have saved about $3.5 billion that we would otherwise have spent had we not changed policy back in the mid-90s. So we have had a tremendous reform of our long-term care system. You saw reported earlier today some national data that said we were second in the country in terms of the scope and quality of our services. The governor mentioned that in his speech. We are also 30th in per capita expenditures that we devote to these systems. So we're both extremely effective and we're extremely efficient. However, that's the good news. The bad news is since the onset of this deep recession that began in 2008, we have had a serious erosion in a number of the services that are essential to make this work. We have cut home care hours for workers, or for patients. We have reduced the census in our adult day health centers. We have seen funds for the ombudsman program erode. We're at the point when, rather than being reformists, we're into unreform. And that brings us to our current budget that we're looking at in Washington State right now that the legislature is dealing with, that we have to stop that erosion. We saw a presentation earlier today by Representative Reykdal, who talked about the issue in Washington State in terms of the amount of our gross state product that's devoted to public services, and that it has been sliding. Well, this is a manifestation of that. We are one part of that slide, and we have to reverse that pretty quickly, or we're going to see more and more human suffering and serious consequences if we don't act.
So obviously it is not just one thing, it's a large, complex amount of things that have come together to create this over time, but the bottom line is still, again, serving the needs of those people who are out there. And I know, Jerry, one of the biggest things that we've heard today from others, including yourself, is that home health care, or those home health care provider workers that are really essential to this process. Do you see that as being a larger cog than ever before as time progresses over the years here in Washington State?
Well, being able to place effective home care workers into people's homes is the essential way that we've been able to reduce our reliance upon the residential care centers. And we clearly need our nursing homes. They provide a vital service. They more and more specialize in people who have more complex problems. Stays are much shorter in the nursing home than is traditional. But the home care worker is the backbone of our system. And also the worker who works in the nursing home, the nursing assistant certified, the worker who works in the assisted living facility, the people who operate our adult family homes. They are the backbone of our system. And we have to keep reasonable funding for these systems if we're going to deal with the changing demographics. We have more and more older people every day, and even within that population, the very old, the 85 plus population, is the fastest growing element. And they're the people who will tend to need more services.
Jerry, let's talk about the system really quickly. I know that it's in place, and we talked about redistricting a little bit while we've been here today as well, and we're going to talk with our representative from currently what's the 12th District, Carrie Condata, here in just a little while. But is there an intrinsic element to the system itself? You've played the game for 40 years now, in a manner of speaking, that needs to be changed, or is it working just fine? Because so many people are talking about a change in government that's very radical in some corners. Is there a problem there with facilitating this help to people that need it, or is it just a matter of getting the job done in a different way, the way it's structured now?
Well, we have undertaken reforms to use the resources we have in the most effective way. We are now down to the point where we need more resources. And we have a tax structure that is broken in our state. We have a structural deficit. That means that the normal and expected reasonable cost increase of public services related to normal inflation, population growth, aging of the population, far outstrips the normal growth in our revenue system, even in the best of times. And that's because our tax system is based upon an old sales tax model when the society was producing goods more than services. We are now a service economy, and our tax system has not kept pace with that change. So we are destined to lose ground as far as the eye can see every year, except for some brief cycles when you have a bubble related to real estate speculation or something like that. And bubbles never last. We need fundamental tax restructuring. Our tax system is riddled with loopholes or tax expenditures or tax preferences that, if they ever had validity, no longer have validity and need to be examined and can generate a significant amount of revenue. The governor spoke of one today. She talked about $18 million in repealing the out-of-state bank tax exemption for B&O. Relatively small amount of money, but that's because we're in a down cycle. In a normal real estate world, that's $70, $80 million a year. So over a 10-year period, that's $1 billion. That's a lot of money. So I hope the legislature does get it together and muster that 2/3 majority required to repeal that out-of-state B&O tax exemption.
Well, we'll watch and see what they do here through the legislative sessions. Jerry, one last thing I wanted to ask you about. Might have noticed his pin, and we've seen a few of those around here too today on the lapels of others. 56%. Talk to us about what that number represents percentage-wise.
What 56% signifies is that we expect in the November 2012 elections that 56% of the people who participate in the election will be people who are age 50 and above. This number was 53% in 2008. We know that from exit polling. However, with changes in demographics, it's expected to be 56% in 2012. And the other part of that message is these older people care about the issues we've talked about today. And that's the message they want to bring to their legislatures, that they want their legislators to help them be successful on issues of importance to seniors and people with disabilities.
And I know we've talked already. In fact, there was a little bit of an argument about the figures of how many people are turning 65 every day between yourself and Walt Bowen. We'll get the correct statistics for you. But this 56%, Jerry, are we going to see this go even higher in the 2016 elections?
Well, I hope not.
You hope not.
The reason I hope not is I hope the young people come out and participate and vote in greater and greater numbers, because they have a huge stake in the future of this society. And unfortunately, they are the lowest participating cohort in elections. So I hope we're not 56%. I hope we're less than that, maybe a little over 50%. But I want the young people to come out and vote.
That's an excellent message for, again, not just the folks who are in that 56% that Jerry talked about, but in the other 44 as well. Jerry Reilly, appreciate the time today, and appreciate everything you've done in all of the facets that you have over 40 years here representing folks in the state who are older. We're all getting older every day, and I very much appreciate the time. Thanks so much.
Thank you very much.